Homeopathic medicine, pulsatilla. Pulsatilla is predominantly a woman's remedy, and the main disposition of this woman is she is very mild and is yielding, gentle, a woman, and the muscles are usually soft and flabby. And the main peculiar mental symptom of this lady is she cries at everything, and she cries even when she is telling about her symptoms. Cannot control her cry when telling her symptoms. And she had silent grief with submissiveness. Actually, this silent grief is predominant symptom of ignitia, but pulsatilla patients may also have this type of symptom. And the other medicines which has having silent grief with submissiveness is silesia. That is why we call silesia as the chronic of pulsatilla. And if we see the constitutional picture of how this patient looks like, patient is usually very beautiful, very gentle, with blue eyes and read very easily, and pale face, and she may be having scanty hair. And the most predominant symptom, well-marked symptom of pulsatilla is its changeability of the symptoms. There is no head and no tail to the case. That is, one day the patient will come that she have a pain in one particular side of the body, and the next day he will be she then the pain suddenly goes from there and shift to another side. So in multiple visits, she might be pointing out different types of variety of symptoms. Pain usually travel from one joint to another, and there is no. By one time the patient is having constipation, the other time the patient will be having diarrhea. So there is no stools will be like the symptoms will be constantly changing. Another medicine having no two stool alike is senicula, and this changeability is actually very predominant in ignatia also. The changeability of ignatia is due to its ever changing hysterical symptoms, and ignatia and nux moscata also have this changeability. And about hemorrhage of the pulsatilla, if we say that the hemorrhage flow and stop and flow again. So the symptoms will be constantly changing, and it will be stopping and then we will restart. Next is about the rheumatic complaints. In case of rheumatism, the pulsatilla is a good remedy for rheumatic complaint, and there will be swelling and redness of the joints. And in this also, the peculiar characteristic of pulsatilla is the wandering pain. That is the pain wander from one part of body to another part. And when comparing the symptoms like redness of swelling of joints plus wandering pain, this both symptoms are also covered by some the other medicines. Like in rheumatism, it is covered by other medicines like manganum acidicum, lacananum, calibromatum, and calmia lactifolia. And another important sphere of action of pulsatilla is her gastric symptoms. And she will be having bad taste in mouth, which is aggravated in the morning. And very peculiar, uncommon, peculiar characteristic symptom of pulsatilla is dryness without thirst. At the same time, we compare some other medicine. The same time, mercury have moist tongue with intense pain, intense thirst. That is mercury. Moist tongue with intense thirst is mercury. At the same time, pulsata will have dryness, but characteristically no thirst. Dryness without thirst. So that is pulsatilla. And another medicines having this type of bad taste in mouth is bryonia. Bryonia have bad taste plus coated tongue plus he will be having much thirst. So this is how we differentiate pulsatilla from bryonia. Aggravation, fat meat. All gastric symptoms aggravated from fat meat. So that is the aggravation from fat meat. That the medicine is pulsatilla. And And also, if we see the pulsatilla will be having all complaints, gastric symptoms from cake, rich food, pastry, etc. The stomach easily disturbed from cake, pastry, and rich fat food. Aggravation fat food is a characteristic of pulsatilla. At the same time, Nux vomica also is a very important remedy for gastric complaints. But here in how we differentiate Nux vomica from pulsatilla is that Nux vomica have is like fat, and Nux vomica have no problem with fat, and fat agree with the gastric system of Nux vomica. At the same time, pulsatilla can't tolerate fat in any form. Another important characteristic is pulsatilla has greenish discharge, yellowish greenish discharge, and other medicines covering this symptom is carboveg, lycopodium, phosphorus, sulfur, and Paris. And important symptom of pulsatilla regarding her menstrual complaint is that is catamnia suppressed by wetting feet. And the patients, all the complaints of the patients started since puberty, all complaints since puberty. Patient will be saying that she had no complaints since her puberty, she was very healthy since still her puberty, and all complaints started since her puberty. And catamnia also suppressed by wetting feet, so that is an important symptom. And also there will be dysmenorrhea or painful menses, and the patient will be very restless, tossing in every direction, and the pain is usually changeable pain. That is a general symptom of pulsatilla. In menses also we can see that changeable character of the pain, and the flow or hemorrhage that will flow then stop, then flow then stop, and then flow again. So this is the complaint of pulsatilla in menses. And in pulsatilla also there is delayed menses in young girls. Other medicines having delayed menses in young girls is calicarb and tuberculinum. During dysmenorrhea, painful menses, other medicine that we have to think during when in the case of dysmenorrhea is Macphos. Macphos and pulsatilla both can be considered in acute stage of dysmenorrhea, but the follow-up of your case, further follow-up of case is necessary, as this will not cause a complete cure. Giving Macphos during dysmenorrhea will only palliate the condition to prevent the same recurrence, or prevent such an intense pain during next period. You need to follow up the case with further deep acting medicines. And another important symptom of pulsatilla is chilliness with pain, pain with chilliness. So the pain is accompanied with constant chillness. The more severe the pain, the harder will be the chill. So more is the pain, the more will be the chill. Other medicine is having pain with sweating, that is chamomilla. If she is having pain with fainting, then think of heparsil. If a patient is having pain with frequent micturition, then think of thuja. And if another patient is having pain with delirium, then think of veratrum. And the patient usually, a modality of this patient is amelioration from open air. That is a very important symptom. And the patient will be having aggravation in warm room by warm application, and the heat of the bed causes intense itching. That is a symptom of pulsatilla. Another medicine having heat of the bed causes itching is mercurius. And the patient gets amelioration in open cool air, and of cold application causes also amelioration. And at the same time, if all complaints get warmth, then think of the medicine R-salb. R-salb is a medicine which is having highly burning pain. This burning pain will be ameliorated by hot application except headache. So that is a symptom of R-salb. R-salb have amelioration by warmth. At the same time, pulsatilla has amelioration by cold application and cool open air. And in the case of pulsarilla, another modality is she gets a very good relief by walking very slowly around in the open air. Another medicine having walking slowly around is Faram. And this Rextox also gets amelioration by motion, but in case of Rextox, warm dry air, walking in warm dry air gets amelioration. At the same time, Pulsarilla, she gets relief by walking in cool air. So Pulsarilla want to walk in a cool air, at the same time Rextox want to walk in a warm dry air. So that's how you differentiate between Rextox and Pulsarilla. And this pulsarilla, if you think of modality of drinking food, she gets very amelioration by drinking cold food and drinks, and that is retained. And At the same time, if it is nux vomica, he gets warm food that causes increase. Pulsarilla would like to drink cold drinks. At the same time, nux vomica want to drink warm drinks. So that is how you differentiate pulsarilla and nux vomica. At the same time, in the case of pulsarilla, she gets very much aggravation or she vomit by drinking warm food and drink. So pulsarilla has aggravation from warm and nux vomica has got amelioration or agrees with warm. So this is how you differentiate pulsarilla and nux vomica. And headache of pulsarilla is she get very relief by tying up tightly, that causes much relief to headache. Other medicines having amelioration from tight bandaging is argentum nitricum and apis mellifica. And the disposition of pulsarilla is just opposite of nux vomica. Nux vomica is a predominantly a male remedy, and it has very angry disposition, easily get angry and very excitable. At the same time, the pulsarilla picture is just opposite of nux vomica. She is very mild and gentle, and so we call pulsarilla is predominantly a woman's remedy. And chronic effects of badly managed measles. So, in case of measles, if that goes suppressed and the metastasis of measles can settle in breast or in the ovaries, and that can lead to infertility if that causes metastasis to ovary. So, infertility patients having a history of measles, we can think of pulsatilla. Also, in men also infertility after or swelling in testis after history of measles, you can think of pulsatilla. And also increased inclination to maturation when lying down, it's also a symptom of pulsatilla. And it's an excellent remedy for varicose vein. Inflamed parts is bluish, that is an important symptom. Another medicine having very important action upon vein is varicose vein is tarantula and laxus. As I have said before, metastasis of mumps to mammary or testis, and that causes infertility. You can think of pulsarilla. Thank you.